Okay, we're going to go ahead and talk about ethics in nursing. So let's go ahead and get started. There's a lot of gray areas here in this little section, but we're going to go ahead and talk about that. So basic definitions that I kind of want you guys to understand or kind of know is ethics, morals, value, and bioethics. And what do those actually mean? Well, ethics is just a standard of conduct. Basically, it kind of decides what is right and what is wrong behavior. So what is right and what is wrong over here, right, wrong. And then we look at morals. Morals are basically kind of like judgment about behaviors. So this is kind of like about behaviors based on a belief. So it's your morals that you have decided on that you feel those behaviors are immoral or moral. So these are just a couple of examples and things like that. So it's basically morals that you've been brought up with that have been instilled in you through childhood, through experiences, through family, through school, through wherever you're at. And then values are your personal beliefs about the worth of something, an idea, a custom, or an object. So think about, how you feel about maybe Christmas. You feel like your traditions at Christmas are just very special to you, whatever that may be. That's a value to you, where other people may not see that value in that like you do. So those are values. It's a personal belief about the worth of something. And then bioethics is something that we're really getting into more and more because we're coming up with more and more ways of treating things. So this is kind of like organ donation and like genetic research, which we'll get more into that in a minute. And come back over here. Okay, so here's some ethical principles, and you will need to know these ethical principles. So it's kind of how we do all of our ethics as far as nurses. One is autonomy. Autonomy is independence, that self-determination act, self-reliance, giving the patient the choices and allowing them to make those decisions. That's autonomy, giving them their rights and being able to do that on their own. And then justice is just fairness and equality. So justice just means that everybody is getting treated the exact same regardless of who they are or what their financial status is or their ability to pay. That's justice. Fidelity is just faithfulness, striving to keep a promise. So if you have a patient that is maybe they've came in and they've had surgery, and you come back and you say, okay, I'm going to come back in 1 hour and I'm going to check on your pain, and you don't do it, you've broken that fidelity. So that's a promise that you've given to your patient that you're going to follow through with. Beneficence is actively seeking benefits, so promoting good. So it's basically just kindness, doing good for others. As nurses, we practice benevolence every day that we're here. So it's kindness, charitable, doing good for others because that's what we've been instilled in us to do. Non-maleficence is actively seeking to do no harm. So this would be like a doctor who maybe the patient's been diagnosed with a terminal illness, and the patient really wants something done, and they want this experimental thing done. And the doctor's like, you know what? I'm not going to do that because I feel like that would cause harm to you and make things worse than what they are right now. So I'm actively seeking to do no harm. So that would be like somebody coming to work chemically impaired and providing care. They are not actively seeking to do no harm. They might come in that way, but because of their impairment, they're not able to make those decisions. And then veracity is just a commitment to tell the truth, that you're going to tell the truth about something. And then we're going to look at the American Nurses Association Code of Ethics. So these are just principles or obligations that shape our nursing practice. So this shapes who we are as nurses. One is responsibility, basically just being reliable and dependable. So you're responsible. You come to work when you're supposed to. You clock in when you're supposed to. You do all the things that you're supposed to do. You're dependable. You're there. We all know those workers that aren't there, that are 15 minutes late, an hour late. They call in all the time. That they're not meeting that ethical responsibility code. Accountable. Accountability means that you're accountable for your own actions. So if you are giving a blood pressure medicine, or we're giving heparin today, and you didn't check, you're going and checking what their hemoglobin is, you're checking what their platelets are, you're being accountable. So you're going to go give that heparin knowing that you've checked all these things and that the patient is okay to be able to receive this medication. Respect confidentiality. So again, we've talked about that multiple times. Competency. Competency is just basically making sure I'm giving safe nursing care. So I'm making sure that I'm competent in what I'm doing. So we're teaching you competency right now on how to put a Foley in. How do I put a Foley in? Well, I'm going to put a Foley. I'm going to do these competency things to make sure that I know how to do it. So we did a skills checkoff on medications. We did a skills checkoff on assessment. We did a skills checkoff on Foley to make sure you're competent at doing that skill so no harm comes to your patient. Judgment. This is the ability to make an opinion, develop your own opinion on something. And then advocacy is probably one of the biggest things that nurses need to do, is speaking up for the people that can't speak. So making sure you're getting that pain medication for your patient that the doctor forgot to get. Developing a personal point of view. So developing that personal point of view, you have to come up with your personal point of view. And an ethical dilemma exists when the right and wrong thing isn't always clear, or when a member of your healthcare team can't agree on what is the right thing to do. So maybe everybody has a difference of opinion. So ethical dilemmas require negotiation with everybody's different point of view. And some people will say, I disagree with you, and the other person's, well, I disagree with you. Sometimes it's okay to disagree. You don't have to not be friends or work well together. It's okay to disagree. This is my point of view, and that's your point of view. We agree to disagree. But we have to understand other people's viewpoints. But you need to know yours first. You need to know what your viewpoints are on basic things, and then that may help you to understand other people's viewpoints, because it goes back to your morals, it goes back to your values, it goes back to ethics. What are yours? And our point of view is shaped by all the things that we come in contact with our whole life. Moral distress is when a nurse is in a position that differs, that is a difficult situation, where actions are taken different from what the nurse feels is ethically correct. So this may be somebody who is having to help with an abortion when they don't believe in that. Maybe this is a patient who has to help maybe pull the tube on somebody that they don't feel like they should. So those are moral distress. When you get in that distressful situation and you feel like you need to be doing something, but something's preventing you from being able to do that. So examples: abortion, euthanasia, gene altering, things like that are really things that we need to know in our hearts what is right and wrong, or what we feel is right and wrong, and have that in you, what you feel. So ethical theories, there are two that I kind of just want to discuss. There's more ethical theories in this. These are the two that we use the most. One is deontology, and basically this defines actions as right or wrong based on principles of truth and justice. They're not really worried about the consequences so much. They're worried about making sure the truth gets out there. So it's telling the truth no matter the circumstances, even if it's going to cause harm to somebody else. So we have to, that's deontology. So deontology might be, I feel like it's okay that I shoot an intruder that's coming into my house to do harm because they were going to harm me. And I'm not worried about the consequences right now. I'm just worried about justice. You know, they were doing something that was illegal and I took care of it, and this is what happened. Utilitarianism is a little bit different. It is doing the greatest good for the greatest number of people. and usefulness in society. And so, this is an ethical dilemma for some people too, because maybe they feel like, okay, there's a drug out for this, but we only have so much of it. And so we're only going to give it to the people that are under 60, because the people that are over 60, are they useful to society? So we're not going to give it to them. We're only going to give it to the people that are young, because we only have so much. We can only do so much. So utilitarianism if you think back about warfare, and when we had the wars, we only had one surgeon, maybe 3 or 4, I don't know how many we had, but we only had so much equipment. We only had so much stuff. So if we brought an injured soldier in, and they were injured severely, like to the point where we may or may not be able to save them, but if we might be able to save them, but we're going to use all of our resources on this one person, where we have 10 other soldiers that are injured but not as bad, and we could use all those resources on them and save 10 versus 1. And so that's what they think about, the greatest good for the greatest number of people. So how do we process an ethical dilemma? Well, there's 7 steps to it. So you're going to think about your ethical dilemma. So you're going to ask, is this an ethical dilemma? Well, 1, is it legal? If it's not legal, then it's not an ethical dilemma, because it's illegal. Is it a procedure that we're going to do? If it's a policy or procedure that you have at your place, then it's not an ethical dilemma, because we have a policy and procedure for it. And then we're going to gather all of our data. So we're going to gather everything about it, all the facts that go. And we're not bringing in our feelings right now. It's just facts. And then we're going to clarify values. So then everybody's going to get together, and we're going to distinguish, is this a personal value? Is it values of others? Or is it going to cause harm? And then we're going to state what the problem is, not using any of our own feelings. And then we're going to consider the course of action. So list the possible actions, even if we're unsure which one's right. So we're going to have all the actions that we could do. And then we're going to negotiate the outcome. So you need to know how you feel about it, and we're going to have to respect other people's opinion, but it has to basically boil down to what the patient wants. What is best for the patient? Not what's best for us, what's best for the patient. And then evaluate our actions. We're going to look at those. So as far as legal ethical issues in nursing, there's a couple that we see that are probably more so than others. One is usually the end-of-life care and disability indifference. So end-of-life care can have difficult ethical challenges. Do we put a G-tube down somebody who is aspirating on a dying patient? Are we going to do that? They're dying. Are we going to put a G-tube in to prolong it? We don't really know what's going to, that's an ethical dilemma that we have. Maybe we've got disability indifference, so we got a poor fit between an individual and social, material, and technological environment. So maybe people maybe you've got somebody that, as far as their disability, they can't do a certain thing, but it's ethically wrong not to allow them to try. So that there's a lot of dilemmas there in disabilities. Can somebody, that's blind be a nurse? Can somebody, without arms be a nurse? So how do we do this? So how best to nurture capabilities of all humans, regardless of circumstances. So anti-discrimination laws are going to come into effect here. Respect your patient's autonomy. This is going to help guide you and make those good decisions. So the first ethical dilemma we're going to talk about is basically end-of-life care. So you're assigned to the care of a patient who is permanently disabled by a stroke, dependent on others for all of his care, unable to communicate meaningfully. During your shift, as you are providing nourishment by mouth, he begins to aspirate, cough, and sputter. The physician suggests a gastrostomy tube to prevent aspiration. The tube would probably diminish the aspiration, but you find that it would prolong the patient's life, even though they're not going to be able to recover. Is this an ethical dilemma? Okay, so let's look at it. We're going to break it down in our 7 steps. Is this an ethical dilemma? What is the prognosis? and what is the family's perception of the prognosis. And we come in, we find a lot of things here that families don't understand. So we know the prognosis for the patient is grave, but the family might not understand that. The family may think that the patient's going to completely recover. So we need to make sure everybody's on the same playing field. And then determine your own values on this. What would you do if it was a family member of yours or yourself? And then, will a gastrostomy tube improve the quality of the patient's life or prolong suffering? Which one will it do? It's based on your patient. It's based on your patient's wishes, your patient's autonomy. If the tube is placed, educate the family, because someone's going to have to take care of the tube. Someone's going to have to know how to do that. And then we're going to negotiate the outcome. And then we're going to evaluate any kind of actions that we're going to do. Now, that was an end of life. That was more of a ethical issue in nursing. This is going to be an ethical issue, cultural. So you've got a 15-year-old girl admitted with management of leukemia. Her religious beliefs do not allow she should receive blood transfusions. But we know with leukemia, that is probably part of her treatment plan is going to be that. But her parents share her religious convictions, but they will compromise, but the patient won't. She says, I refuse to compromise on that. So is this an ethical dilemma? So step one, we got to do our 7 steps. Is it an ethical dilemma? Do we respect the patient's autonomy versus the healthcare wishes to do no harm? Because we know that if we don't give her blood, we will do harm and she will die. Step 2, gather everything that we need. Gather our information. How soon are we going to need that transfusion? What is the patient competent? Is she aware of all the consequences? At 15, is she aware of what's really going to happen? Does she really believe that she will die? Examine your own values. How do you feel about the patient's religious beliefs? Do you agree? Do you disagree? Can the patient really understand what the medical course is and all the consequences if she chooses not to do them? And then state the problem. Minor refusing life-saving transfusion. If do the transfusion, dignity will be compromised. If we do the transfusion, dignity will be compromised. If we don't do it, it will be fatal. So we have to think about those 2 things. Then consider the course of action. Healthcare team respects her wishes. Could we force the transfusion? Do we encourage support from religious leaders? Do we bring her people in and have them talk to her about it? And then negotiate the outcome. Do we get a court order? Do we ensure that her voice is heard? Do we compromise with her? Do we ask for help on this? What do we do? And then evaluate your actions. So it depends on what we're going to do on the agreement that we reach with the patient, the healthcare team, the parents, and everybody involved. So the goal's basically just going to be to balance the respect for her autonomy and also the principle of beneficence. Are we doing what is best for that patient to do no harm? And then social media also carries, your ethical dilemmas. So, social media is great. It's a great networking tool. Just be very cautious about what you're putting on your social media. This is just an example of social media. You guys can read it and decide, and the next step is going to do this one. So this is a social media dilemma in that. So we're going to, here we are, we're going to gather our information. We're going to do the same thing. And there's no right or wrong. It's based on what you think. So you can go back and kind of work through that ethical dilemma. And then that is it. I hope you have enjoyed ethics.